So today let's get a glimpse of what are the types of hypoxia. So let's define hypoxia first. Well, hypoxia here is simply inadequate oxygen delivery to the tissues. Low oxygen, less than tissue requirement delivery. And sometimes we confuse between hypoxemia and hypoxia. Well, hypoxemia is just low or inadequate oxygen carried by blood in the blood vessels. For today's video, we will just stick on hypoxia. Before we discuss the types of hypoxia specifically, let's just jump briefly into the early signs of hypoxia. Well, the early signs of hypoxia, we will use this abbreviation or the medical mnemonic. The mnemonic is RAT, where R is restlessness, A is anxiety, and T here we have two T's, that is tachycardia and tachypnea. So these are the early signs of hypoxia, and you have to differentiate between tachypnea and hyperventilation. These are things that students do forget. Tachypnea is simply accelerated or increased rate of respiration or breathing, while hyperventilation is increased pulmonary ventilation, that is increased air entry or air exit out of the lungs, that is more than body requirement, and sometimes it can lead to respiratory alkalosis. Let's now jump to late signs of hypoxia. With late signs of hypoxia, we will use this medical mnemonic. This is simply abbreviated as BED C, whereby B here stands for bradycardia. The patient now will become bradycardic instead of tachycardia. And here E will stand for extreme restlessness. And D here will stand for dyspnea. Our patient will become very dyspnea. And C here will be cyanosis, that is a bluish coloration, usually on the membranes of the lips and even the palm of the patient. Types of hypoxia. So this always depends on the step affected. Meanwhile, how do we arrive at being hypoxic? Number one is the lungs, which is the pathway that brings air into the body, brings oxygen into the body. Then we have number two, which is oxygen transportation. What transports oxygen? These are the blood vessels, and at the lung we have the alveolus. Then we have the oxygen carrier, that is the blood or RBC, which contains hemoglobin. Then finally we have the systemic and pulmonary circulation. So if any of these are affected, we will end up in hypoxia, either in early stage or in late stage. Now let's discuss the types of hypoxia. So in simple term, hypoxia happens when air from the alveolar does not adequately pass to the blood vessels. So if this area is affected, we get hypoxia. And this happens when we have patients with pulmonary diseases, e.g. COPD, pulmonary edema, ventilation, perfusion mismatch. We have things like high altitude respiratory diseases. It happens to mountain climbers or people living high altitude, because they say that the higher you ascend high altitude, oxygen decreases. So when you go higher, the concentration of oxygen decreases with increase in altitude. That's why most mountain climbers do faint, because they undergo hypoxia. Number two, which is the second type of hypoxia, is anemia hypoxia. Anemia hypoxia here happens when blood, which is normally RBC, fails to deliver oxygen to the tissues, does not deliver adequate oxygen to the tissues. And this happens when the blood is less than body requirement. That is, the patient can be anemic, can have underlying causes like sickle sickle cell anemia. We have things like carbon monoxide poisoning, CO poisoning, because we know the carbon monoxide react with the hemoglobin to form a very permanent compound, so called carboxy hemoglobin, which prevent the normal oxygen from combining with the hemoglobin. So we find that this patient get anemia hypoxia. And also there are some circumstances where we have severe hemorrhage such as hemorrhagic shock to be precious. This lead to less oxygen being transported to the tissue due to decreased blood, specifically RBCs. So we get the so-called anemia hypoxia. Number 3, we have the so-called stagnant hypoxia. This is usually due to heart conditions, which is sometimes called ischemia hypoxia. And this happens due to circulatory shock. There could be problems like congestive heart failure and other conditions that prevent the heart from its normal pumping of blood, and this leads to insufficient blood carrying oxygen delivered to the tissues. Some are congenital disorders. That's why we say it's a stagnant hypoxia. Usually it is not solved so quickly. The fourth one, which is the last one, is the histotoxic hypoxia. This happens due to inability of the tissues to use oxygen delivered by blood to them. This usually happens when, for example, the tissues are poisoned. Like we have a common one is cyanide poisoning. So when the tissues are poisoned with cyanide, the cells are broken down. The cells undergo hemolysis, and now they cannot carry any oxygen. They cannot utilize any oxygen. Like mitochondria cells in those tissues doesn't work anymore. So the oxygen is there, but it's not utilized. Other things include cancerous tissues or malignant tissues, and other tissue disorders that makes the tissue unhealthy will lead to histotoxic hypoxia. So just short like that is all about the types of hypoxia. Stay tuned for other videos. Thank you for watching. Do not forget to refer your friend to watch our videos.